in for a treat, let me tell you. This video is about to show you an insight as to the do's and don'ts in Pilates. Now, there's a lot of stuff out there that you can look at on the internet or through videos, but let me just say there's a lot of Pilates information out there that isn't safe for your spine. So my goal here, with Rebecca as well, is to educate you and show you what to do and what not to do when you're doing a Pilates class online or in a group situation or even at a studio.
One of the most commonly performed exercises in Pilates is spine stretch forward. It's in the basic mat order and it replicates the way our spines move throughout our normal, everyday, average daily lives. So it's a very, very familiar exercise for people. Some of the other basic mat exercises are not the way our bodies move every day, but spine stretch forward is. So you're going to get into position for it. And Vanessa's going to show you how it's normally performed.
So we reach forward, but our spine normally goes into a rounded curve, as you can see.
Correct. Now, if I ask her to hold this position, what you want to look at is the position that her low back is in. What the research tells us about how to keep your spine safe, it says not to do this. This is exactly the slouch and hinge position for the low back that we would have when we sit with poor posture at our desks. Stack back up. Just like if you're a social smoker, you think your lungs don't know that? We cannot compartmentalize poor spine mechanics in the name of a Pilates mat class, in the name of an improperly taught Pilates teacher who doesn't have the information that they need to pass along to you, the client. So you, the client, have to understand the basic safety of good posture. It turns out our moms really were right. Just sit up straight and everything takes care of itself. And we have to learn how to apply that good posture, those engagements of those deep back muscles that keep us lifted and open, to a Pilates exercise. So now Vanessa is going to do it with a lengthened spine, because your safety rule is to distribute weight and movement over the greatest distance of your spine possible, and then your spine will last as long as possible. So the same exercises done differently. What she's having to use to keep the weight off of the front of her spine. Remember, the spine's way in the back of the body. Everything else is in front of it. She has to contract deeply the muscles that run up and down her spine on the back of it in order to keep the weight from crunching down on the front of it. She doesn't get to go as far, but anytime, remember, social smoking, anytime you bring your ribs down towards your hips, your low back is in between those two structures going, what? Get off of me, because it's way too much weight. And we know from the studies that that hurts your discs. It creates micro damage that's permanent and irreversible. It hurts the discs in the front by squishing them. It hurts the discs in the back by splaying them. It hurts the ligaments in the back by splaying them. So as an example of spine stretch forward, which is a classic indicator species for a flexion exercise, we've got to try to keep as much space as possible for the low back to stay lifted. And that requires much more muscular engagement at the deepest level, which is what Pilates is all about.
Absolutely, and you can feel the difference so much. When you go into that flexed position that you think is correct, it actually puts a lot of stress on the back. It aches quite a bit. Whereas when you lift up out of that and lengthen the spine, you have more control. You can feel the deep muscles working and it doesn't hurt. And that's the whole point.
You won't get stronger by optimizing movement through those 4 hinge points that we talked about. You won't get stronger doing that. And the rest of the joints are wondering when they get the work, because you are not working all the way through your spine when you optimize movement in these places where, just because of our bony structure, we articulate very, very strongly in there. The weight will fall into the hinge, which is how many Pilates teachers have been taught to perform the work.